welcome everybody. Thanks for being here. My name's Camille Nebeker. I am a PI on the ethics core for the Bridge to AI Center. And I'm going to be sharing my slides with you, but I'm also teeing us up for what I'm hoping is going to be a conversation that we have after I tell you what I'm going to tell you about. So let's see, share slides. Um, So back in October, November, and this is after we have been, working as a consortium for, gosh, I think it's been almost 4 years. Um, so for the past couple of years, a group that is the ethics working group has been working on defining what it meant to be an ethically sourced data set. And we published this paper back in October that is very conceptual. And so, just to back up a little bit, the reason that we wanted to define ethical sourcing is that Bridge to AI in its mission had branded the data repositories that were being created as being ethically sourced, trustworthy, and AI ready biomedical flagship data sets. And what ethical sourcing meant wasn't clearly defined. And, many people who I would speak to over the course of years would think, oh, we got an IRB approval, and that means that we must have cleared whatever is needed in order to be ethical. And we took some time thinking this through, but those of us who are involved in the ethics working group really see ethics as foundational and not something that you just add on. And so we spent some time thinking about it because doing work, creating an ethically sourced data set does have direct implications for trust and downstream perceptions of what we're creating as part of the Bridge to AI data sets. And so I'm briefly going to touch on the paper, and then what I'm going to talk more about today is what do we do next? How do we operationalize this conceptual foundation? And what we did with the paper is we used value sensitive design, which surfaces the stakeholder values and helps us think through what are the ethical tensions across each one of these stages of building a data repository. And then what I did was I tried to find out where does the term ethically sourcing start? Where was its origin? And it happened to be in the supply chain management literature. And so I spent quite a bit of time diving into that literature to learn more about, well, what prompted it and what does it mean? And I think I've mentioned in prior conversations that it really had its origin in some of the big corporations that had done things like polluting waterways, hiring children, having very unfair labor practices that went into the process of making a product that would go into consumer households or be purchased for whatever reason. So looking at what supply chain management meant for us was really trying to think through how do we take our values and apply them to these different processes. And so the combined framework really helps us think about what ethically sourced data creation looks like from the very beginning of planning a data set through the process of implementation, making it accessible, and then managing it. So again, because we were doing this in parallel with the data repositories being built, I want to stress that most repositories were being designed before this framework ever existed, and that ethical sourcing can be strengthened retroactively. It's not like the boat has sailed and you have no way of no recourse. And so the gaps that you may identify now that we have more of a framework, they can be mitigated. And I think that's the goal here is thinking through now, maybe we didn't do that at the early stages, but what can we do now? Could we implement different kinds of documentation, governance updates? Could we do more with community engagement and transparency? So the values that we took away from the value sensitive design was looking at transparency and how does that present when we think about data provenance, documentation, metadata. And then thinking about accountability and governance and stewardship, data integrity, which is focusing on quality and validity. What does sustainability look like? What is the long-term planning? What is our responsibility in that respect? And then thinking about, the extent to which respect for persons is demonstrated and how much weight do we put on community engagement? How much weight do we put on individual consent? Um, so when it came to the supply chain management, looking at the steps that start at the very beginning, like assessing who demands this data set, why do we need it? Looking at whether or not there's a scientific justification, evaluating what some of the downstream risks might be. And then once that demand planning is completed, then you start designing the supply chain and thinking about the architecture and the governance. And this happens well before any data is ever obtained. And then when you get the governance in place, you start thinking about, well, what are the data that are needed? Where do we find those data? Do they exist? Do we have to get them prospectively? What kind of agreements do we need? And all of that has to happen very early on. And then you have processing and quality control. You have distribution and controlled access and all those processes that need to be put into place. And then ongoing monitoring and improvement. So again, all of this is coming out of the supply chain literature and we're applying it to what we're doing. So this table comes right out of the paper. And you can see in table one, we have each one of these steps along the left-hand side. We then talk about the activities as they present in supply chain management. We then transition to what does that look like when you build a health data repository? What are the ethical sourcing values? What does it look like across each one of these different stages? And then, really important, who are the actors at each point in this process? And how do they know how to work together? Do they? And, the other thing that's really important is, do they have the necessary expertise to do the job? And so you have to really bring together some teams that may not have worked together before. They may have different languages that they use to communicate what it is they do. And it's a very complex ecosystem. And then the training that needs to happen, all of these things have to be at the forefront of creating one of these health data repositories. And as I get into who are the actors and the roles, and I'll show you another table that we put in, but it's really looking at, what is the sponsor's role in creating these flagship data sets? Who are the data contributors and who are the communities that are going to be represented and how are they involved? What is the governance plan and stewardship? Who are the clinical and research teams involved? Who are the data creators, designers, and users? And then we have the regulatory and ethical perspectives to think through. So these are, again, all things that we need to be paying attention to early stages. And so this is one of the tables that talks about who are the actors, what is their role, what are their challenges, because it's really important to look at tensions between different actors across the lifespan of this data creation. What are the mitigation strategies? What values do we draw on when conflicts arise? And then what are the open questions? There are definitely things we just don't know the answers to yet, and we have to continue to keep those on the table and continue to talk about those because we have new and different responsibilities moving forward. So, where I wanted to go today is to think about what does it mean to put this into action? So, as I mentioned earlier, Bridge to AI set an ambitious goal of creating ethically sourced AI-ready flagship data sets. And early on, ethically sourced meant different things to different teams. And what our paper did was propose this framework. And what I've done as a next step, with honestly no other input than the paper, is to create a checklist that DGPs can use to think about what is it we did, what is it we may have missed, what is it we could go back and maybe, look at and think about. And so the checklist is really thinking about how do we put ethical sourcing into practice. And so these again, are coming from the paper. These are the steps of what happens in the supply chain management as it translates to a health data repository. So for each one of these steps, we now have a checklist that um, has these different areas. So you can see here, there's purpose, scope, and demand planning. And the prompt here is on the left. And so evaluating the scientific purpose, the intended downstream uses, and are those clearly documented? Anticipating ethical risks like bias, misuse, re-identification, group harm, were those identified during planning? Less risky alternatives, were those considered and documented? And the data set is not being collected for vague or speculative for future uses. So for doing a self-evaluation, and that's how I imagine this, is that this would be used for the DGP teams to take a look at how are we doing. It's not something that somebody would come and do to you. It's something you do for yourselves. And you evaluate, yes, I did this, kind of did this, not did this, or it didn't pertain to us. And then you can document what you did under the evidence column, and then you can identify what your next steps or action plans would be. So you can see here we have purpose, scope, demand planning, provenance, traceability, transparency. Um, so an example here, third-party data contributions and vendors are disclosed. Uh, Metadata captures collection content, time, place, setting. And this is, again, I about an hour ago asked some of my colleagues from the standards working group to join us because I think there's quite a bit of potential intersection with the data sheets for data sets work that we've been doing. And I would love to see how these might intersect because I think that they could be really powerful together. The next section is on consent, authorization, and participant expectations, where, we talk about here, does the consent language cover actual data uses, including the use of AI ML? Are secondary uses aligned with the consent scope? Are there any misleading statements about risks or sharing? And these are things that, clearly you would have an institutional review board involved with, but you may also want to have some beta testing happening with people who might be participants in the research. And I think Voice has done some of that work. And so the next group or chunk of sections is on equity, inclusion, and bias mitigation, um, data quality and integrity, governance and oversight and accountability. Um, and again, ethics, an IRB review is only one tiny piece of all of this. Are the roles and responsibilities for stewards identified? And so some of these got cut off, but this is again just a starting point for a conversation. So then the last three are privacy, security, and risk management. And again, these aren't like in the order of when they should be done, but they could be. And that's something else that we could talk about, like what has to happen first. Um, and so sustainability and stewardship, do we have a plan? Is it resourced? What are the maintenance responsibilities? Are those defined? What about data set retirement or archiving? And so these are things that all should be discussed. They should be documented, and they probably aren't or are to some extent across different projects. And so I just wanted to show you that's what the checklist version 1 looks like. And this is what it would look like if it were completed. So this is just an example. So the prompt is consent processes were appropriate for the population and context. Checkmark says yes. Evidence says participants were consented in person or via an IRB approved electronic consent, workflows at participating site with accommodations for accessibility. Next steps, continue monitoring consent comprehension through participant feedback surveys. If that is even, I mean, these are just, hypothetical. So this one here, withdrawal process exists where applicable. So explanation is participants may, this is a partial, they may withdraw prospectively. However, limitations on removal of already user-defined derived features are not clearly explained. So the action item is clarify what the withdrawal limits are in participation materials and repository documentation. This is an example for, I think this is on the data management plan. What are the access criteria and are those transparent and justified? So then it explains where those are, talks about publishing a simplified access overview on the public website. Over here, monitoring exists to detect misuse, partial. So talk about access logs are maintained. Active auditing of downstream publications and derivative models is limited. So again, an action plan can follow. So what I wanted to talk about today is the extent to which this would be a useful tool for DGPs to use, or anybody who's creating a data repository. So the first step imagine is that the GDPs could do a self-assessment. They could identify what the top strengths are. They could identify gaps. They could develop action plans. And if desired, they could publish public summaries of what they're doing and what, where they see strengths, weaknesses, and areas for improvement. And so while this is, I'm thinking about where this could be embedded because I tend to go beyond conceptual. I like to get things into action because otherwise it's kind of like I think we all like writing papers, but it's really nice when they get used. So I think about like embedding some of these concepts into the data dictionaries and metadata. And again, this is why I wanted to have some of my colleagues from standards here. We could think about integrating this into the onboarding and training processes. We could think about using these in future milestones. But for now, the checklist is where I decided to start. Um, and so, what would this look like if we were to operationalize this? And what support or standards would help you the most? And with that, this is the paper, and you can pull it up. It's open access, or I can drop it into the chat. And I'll stop sharing. And um, I would love to hear more of a conversation. So if you feel like putting yourself on video so we can see you and have a conversation, that would be great.
Well, that was sorry I was late for the introduction, but in fact I did it in the chat. But that was a wonderful presentation and actually very challenging if you think about it. I mean, particularly in light of I think some recommendations that are contrary to what the NIH has in mind. But in any event, I would like to, but I would really like to hear what other people have to say, and then we can go from there.
I will put a link to the
Jamie, I
paper in there
opened,
right now. There
yeah.
you go.
Well, let's see. I guess I probably have a lot of background to share, but maybe I could do that at a different time. So thanks, Camille. This is amazing work. Get familiar with your paper. Thank you. And I do like the checklist. The self-assessment is interesting, right? That seems like maybe with training people, right? We could get that one to work. And that would be a very easy way to start things, right? So, but of course, the self-assessment maybe has some challenges when you compare across different people doing it. And that part I haven't solved yet, right? So I think we have a little bit of that in the readiness. I think we probably could help you with, some LLM assisted evaluation, which will probably not give the level of detail for the actions that you had. I think that was actually amazing, right? So if something was not working in that assessment, with the next actions you provide there, I think, right, are not going to come from anything else. So that probably will still need human review assessment.
Mhm.
And maybe, this is just LM first pass to say it can do something like, the text in this field, supports the statement or not. And you could even cite that text, I guess. So I'm interested in how to help humans, right, get it like up here, because it feels like we're being handicapped quickly in various ways, right? All right,
How do
so
you
that's
see the LLMs working? Like if I
Mhm.
was with voice, And I wanted to assess whether or not the processes we put in place to build the voice data repository hit these prompts.
Hmm.
How would I use an LLM to do that? Like, would it know to where to go into our processes to look?
If you have those documents, you could definitely point it to that. I can maybe quickly say what we do now, right? So we have a schema that has some specification and descriptions about what we expect in different fields. And that's something that we've iterated on and will continue to iterate on, I guess. And so then you can take one of these filled out records, right, like a data sheet, and against that schema, and also the input documents we give. So I guess maybe in this case, the equivalent would be any guidelines, right, or structures, or maybe regulatory provisions, right? All that can be in the mix. And then you can ask, given these three things, right, how well does this record A fit the structure of the schema? That's maybe less interesting sometimes. It could be about which fields are present. But the second thing is you can ask, based on this statement in this records, what of these input documents supported that, right? And then I think it starts getting interesting. We haven't actually provided the snippets of evidence yet, although I think now in some smaller cases we could, maybe if we just do it for 4 documents. And at that point, you get something like, and I can maybe even share this, although it's very beta drafty, right? Where you get some statements about this field is present, but it doesn't quite, say we would like it to say here, which is more than just saying it's missing a value, right? So I don't know if that helps you. That's probably where we are currently.
Yeah, it kind of makes me think that putting this checklist up for consortium feedback
Hmm.
would be a really good next step
Yeah.
because when you talk about using an LLM, I'm imagining Bavesh
Hmm.
and all the documentation he has on GitHub.
Right.
So could you put this and
You
say,
could.
did we do that?
Yeah, that's right. That's
Somehow
right.
it could do that.
Yeah, yeah.
But when your I think maybe it was your comment, Ellen, that every DGP is doing something a little bit different. So these prompts may not pertain or they may not be worded right. So I'm just, but
Mhm.
I I get frustrated about the fact that we wrote this really cool paper, but what's next is the implementation and I can't say that word. Um,
There we go. Right.
operationalization.
That's right. That's right.
Um, yeah, it's just like I really want
Mhm.
people to have something to guide them,
Mhm.
and even humans being able to look at. They could take chunks. I mean, there's I think A
Mhm.
through L. They could take A, B, C, and D, and in the next 3 months say, this is what we did for A, B, C, and D. And then give me feedback on A, B, C, and D that did or didn't work. Okay, Moni.
Absolutely. That's exactly where I was going to start with. There's a little bit of social engineering that will take place in order to get all of the grand challenges and anyone who's interested in assessing how well their data set capture is being, ethically sourced and how well they're meeting the expectations that you have on the checklist. But it's a really good starting point. And so I think that the experiences that we have had are very positive. We've managed to collaboratively come to agreements of what actually constitutes useful information for us in terms of determining AI readiness. In this case, would be on whether or not you have met these specific goals for being able to have an ethically sourced data set. But it's how the trick has been to bring to the table each of the interested parties of the grand challenges who are most invested in making sure that the data sets are well represented. And so we start that conversation like that. We bring them, at least one, in some cases several representatives from each of them go through the checklist. In our case, it was also a table on a spreadsheet, as you remember,
Mhm.
and then just review and provide them with a means to write a note about, I don't understand this question. I don't think this is being asked correctly. This doesn't apply to my data set. And with that, I need some type of refinement. I think I like the way you have stated these questions on the checklist, and I think that's a brilliant way to get that conversation started. And then in terms of the, how do we actually get people from being invited to self-assessing? The carrot at the end of all of this is to be able to share with everyone else in a public manner how well you have adhered to this goals of ethically sourcing. And if if the project isn't yet perfect, then what are the opportunities for you to be able to move your project forward so that you meet all of those? And they adjacent to that, but not directly related. I was looking through, your slides and thinking of the steps that we have taken in order to capture metadata with information about the ethics and the governance that you helped us with, like, where we have questions like, were there any ethical or compliance review processes that were conducted? Provide a description of these. Who's the contact person for you? So we have in the data sheet, it started to, as Marcin said, we have been looking into the architecture, but there are fields that we have specifically defined for capturing information about ethics practices and then for governance as well. So just data governance in general. And so I think that there is a very good overlap. And as you said in some of your late slides, you want to make sure that this is something that can be encrusted into the metadata. I think that we have a very good opportunity to making sure that the questions that you have help us refine the fields that we have defined for ethics and data governance. And so let's make sure that we do that connection at the end of your checklist with what we have on the data sheet to make sure that we capture that accurately. And maybe this is one way to help disseminate the products of your checklist as a yes adherent, no, opportunities are still there. It could be one way of putting that into the metadata.
Thanks, Moni. And I loved your comment about social engineering. I think that's so true. And it's doubtful that anyone would ever get everything yes. I mean, it's just not intended to be perfect. It's always a work in progress. And I think that's the message I want folks to have. It's like, you're not supposed to be perfect. We didn't do this before you got started?
Mm-hmm.
So anyway, it's just, yeah, the socialization is really important.
So I wanted to just ask you a couple of questions. First of all, terrific talk. Um, and I have a couple of ways to think about how to get the information that you want. I think one of them is to say, you are asking questions that are meant to get you into a particular domain. And one of the big domains is, do the people whose data are being used actually understand what's going on? I mean, do they understand that? And then you have a number of prompts that are designed to get at that. Another thing to say is that to actually ask them to specify the steps of their governance oversight and ask them to talk about what they are and their competence. I mean, IRBs are involved. IRBs are not competent to do this. I mean, and so, I mean, so I think, that's a thing. And then, of course, one of the big things about this is, of course, the NIH is moving toward CADRs and to moving to data access committees, NIH data access committees, which by their very nature can't be representative in the way that we want them to be. And so so I would say the only thing, I mean, I just think this is brilliant, but I think you could help make it more useful if you sort of say, like when you're talking about the consent process, to just preface this and say, don't just look at your form. Do you think people actually understand? I mean, because anybody who's honest knows they don't. And so, so I think that, sort of just framing it a little to say what you're driving at, so they don't nitpick, or they don't do, or they don't say, well, I can think about it in this way, which means that I comply, even though I really don't. I mean, you know, as somebody who's been deposed in the past, that's exactly what you do. And so, and we don't want that. You know, what we want is something different. And that is to think about the, to think about how these data are obtained and used, which you did so brilliantly in your paper, and but a checklist is only as a prompt. It is necessary but not sufficient, is what
Right.
I'm
But
saying.
at least, what it does is just gets people to reflect. And I
But you
think
need to
that's,
tell them that's what it's for.
yeah, right, to be
It's
more
not like
explicit.
if you do it, then you're get out of jail free. That's not what you want.
Right.
Um, but
El-
but
I was going
so
to ask you, Ellen, if you had a thought on what would be sufficient. What else is missing here? Do you have any thoughts on that?
yeah, well, that would be a good question. I mean, that would be a good question. Although honestly, Camille's paper is so comprehensive that it's hard to figure out what's been missed. But uh, but I do. I just see. I just see the NIH running in the other direction as fast as they can. So I just am, that's just a thing. So um, Francis, who's getting ready to give a talk at Minnesota on their Research Ethics Day.
Yes, and sorry I'm not on camera. I'm in transit, and I hope you can hear me. Okay, Camille, great to as always to hear you talk, and I love the paper. So I have a thought and a question, and it actually dovetails nicely, I think, on the theme the last couple of questions, which is that the checklist is not meant to be the sort of checklist. Some checklist, for instance, before surgery, I would put in the category of if you do not check every box, you should not commence the surgery. That is, it is a checklist that is you must do all these things. We have the same stuff, right, in some of our work. Some checklists are really optional, but I was trying to think of what the reasonable standard of care would be so that if someone didn't meet it, they might be liable. And that's always one lever for enforcement that folks sort of tune into, which is, oh, wait a second. Oh, this is something I really have to do because if I don't, we've got some liability. And I don't know if you could put a finger on it yet, but it might be interesting to either based on just your anecdotal experience, or I don't know if within Bridge CII there's some sense of what what is the reasonable standard of care on that checklist? That is, perfection is not the standard, but neither is zero. And what's reasonable? Of course, reasonable is gray. That's why we use the word. But I'm just wondering if you have thoughts on sort of where that reasonable bar is, and if there would be any cause for action. I don't know who would bring it. I think it's one of the tougher things here because those harmed, it's a little hard to for me to figure out exactly who they are and who would have the claim. But yeah, I'm just wondering what you think about where how much does someone have to do? What's reasonable?
Wait, that's such a good question. I know when you say, when you brought up liability, I just shivered because I think about like motivation to keep myself from getting in trouble. This is my hard wiring, so I'm disclosing personal things that I have a real resistance to authority. And if I'm not motivated because I know it's going to make my product better, I'm I don't think I'm going to be too excited about it. So I would think that if there could be like a badge where somebody's motivated because they're going to be able to put the seal of approval on their data set because it's they've gotten 70% of these things right, and somehow we've identified those that are deal breakers, and you really have to do these to be in that 70% or 80%. And again, I'm talking off the top of my head, but I would love to see people encouraged by being able to put this label on their website saying, we did these things, we met the standard, and we've got the good housekeeping thumbs up. I love that, but if it's a liability thing and I'm afraid, that's not the setup I want to go with. So again, I'm curious about others, what you all think about should we go through these prompts and identify which ones are absolutely required? But can we say that when these data sets are so different? And then what percent would you need to have said yes to in order to get this seal of approval? I mean, I think you posed a really thoughtful question, Francis, and it's always good to see you.
Yeah, a follow-up would be how much it's procedural versus substantive. That is, let's say a research team tries really hard to do everything on the checklist. And as you've pointed out, for a lot of reasons, they might not be able to do some of those things. But it's basically like the A for effort sort of versus, hey, it doesn't matter if you tried really hard. If you didn't actually substantively accomplish, X, Y, or Z, you don't get the seal. And as an implementation thing, it's creates an interesting question, which to incentivize, because if the bar is too high or you think there's no way we can do this, we're not even going to try,
Mhm.
versus, well, you know what, if you just try, it's same with our students, right? Sometimes we give them credit for trying in some way. So I don't have any good answers to that, but those were what I was thinking for about implementation. Thanks so
Thank
much.
you. Thank you.
Yeah.
Well, maybe I'll just go very quickly and then let Sam speak. So I posted some things about minimal information standards. There is some precedent on that. Those are usually about a data record, right? So maybe a little different. And this maybe to riff off of Francis's comments. So, one issue we're dealing with here is that really there are no good records out there for these things, right? So that would be incentivization number one, I guess, just to have them around as something that people could look at, right? And then, of course, once you have them, then I think it would be great to come up with some minimal requirement, right? That would be actionable. And maybe then you get the seal of approval, right? Something like that. But so that's been something we've been grappling with for a long time here, right? Is that it's very hard for people to fill out these things. No one really wants to do it. It may involve multiple experts. There's no good instructions, right? And examples. That's really where we are, I guess. Thank you.
But I think back to your LLM idea, if we used an LLM to do the first pass on a DGP and then ask the humans from those DGPs to check it to say, did it get it right? Where did it get it wrong? And that might be an easier way to start
Yep.
getting it elevated.
Hmm.
Makes sense, right? Yeah, I mean, you could even ask something like which of these are most relevant or not relevant, right? To help answer that question. In anticipation, there will be some pushback, I guess. Right? It seems like people think, right, that that would be one element here about social engineering, maybe, right?
Yeah, let's talk about this. I'd love to keep talking about this at our standards working group.
Yes, ma'am.
Yep. Sam.
The only thing I was going to add to this is I might take a slightly different approach that I think would be or could be more productive. And that would be to ask everybody to do their best to complete all of the checklist and then to explain why they could not. And try to determine if there are some particular types of studies that have a harder time with checklist items, and then determine whether or not that can be modified in any way, or there could be a side checklist that addresses the difference in types of project structures, but is still aiming toward the same level of, your good housekeeping standard of seal there. But I think it would be just as interesting to know why they can't, rather than just leave it to, well, the ones who will do it, and the ones who won't can bypass it. I'd like to know why they can't do it.
Yeah, so those are two really different approaches. One's using an LLM where a human would then go through and check, and the yours is more about what isn't possible and what is. And I guess my follow-up question is what would motivate a DGP at this point to want to do this? I mean, is there some incentive for them to, as they head into this year, to want to do that?
I'm sure NIH could provide an incentive.
It seems like the field is changing quickly. So I think even the year since we last updated AI readiness, there are multiple new things. I think FDA has a new machine learning guidelines, right? So these extra documents keep popping up. And I guess if we can somehow link to them, right, then we could say, by doing this, you satisfy all these different regulations, right? That's not going to be an easy road, but maybe.
So just a couple of things to say here. One is I thought Francis's points were really very telling. But I was just thinking that actually it's really hard to bring a lawsuit for informed consent in research. I mean, and in fact, nobody does, or very little, you know, you have to, something really, really has to go wrong. I think that the more scary issue is that the states are doing all kinds of stuff in data privacy. And there might be some states where this is an issue. So I just am raising that. I just want to reiterate something I said a little bit earlier. One reason you can't do some of the things that you talk about is it violates NIH policy. I mean, you cannot have, you know, community members involved in data access because it's not permitted if it's in a counter. I mean, and it's been that way for 20, 30 years. And so, you know, so I think, you know, I think that I think the real virtue of your checklist is not to say that everybody should get 100%, because frankly, they can't. I mean, or I don't imagine how they can. But as much as we're all gunners on this call. But I do think that it is a real incentive to be transparent in our research about what we're doing, what we're thinking about, you know, what we're telling our participants, what governance is in place, and, you know, and being transparent about that. And I think about something we did with BioView many years ago, our big DNA database, which is that we put a summary of every single study that we were doing with those data available on a website. And so I think thinking about this checklist gives us an idea about how we ought to think about these issues, and challenges us to do better. I mean, which I think is fantastic. So that's what I would say.
Thanks, Ellen. That's brilliant, Ellen. Thank you. You asked a question a second ago about what would incentivize a grand challenge to self-evaluate and get this, you know, certificate of completion, or at least of evaluation. And I can think of a few things. Some of you have already shared some of them. But I also see it as a possibility for the grand challenge to being able to demonstrate goodwill toward community feedback and the enhancing their own dissemination practices by guaranteeing adherence to this like ever, you know, the more widely accepted concept of ethically sourcing your data. And if nothing else, also to be able to show off your ability to evolve with the field. As you said, these practices, we recognize them, and you and and Ellen and so many others, extensive body of work is informing all of this. And this is a cooperation of minds who have been thinking about this very hard and very long, and have come up with this information about what could make your data generation practices better. And I think it's in the best interest of all of the projects, not just for the purpose of the data being generated with Rich to AI, but for any future projects to be able to say, we actually took to heart and into consideration what the community has been sharing about the importance of ethically sourcing our data. And, you know, I would imagine I'm not the only one thinking of what does the future of science holds. And so being able to say that you are thinking about these things even after the fact, even after some of your data has been generated, and that you're accommodating and evolving, it's also giving you I think strengthening your credibility as a researcher too. So I think there's a lot of opportunities for the projects to say we are in with the times, we evolve with the field, and we have goodwill to receive feedback from the community that knows what they're talking about.
Thanks, Moni. I really agree with that. And when I think about the branding early on of ethically sourced, AI ready, trustworthy flagship data sets, I was like, where's the substance here? What does that all mean? And now I think if we really wanted to say that, we would say, yeah, because we did these things. And we can say we did these things and it meant something to us, and the public should know that it matters. So I think
Certainly.
now we have the tools to have the substance, and it's okay to go retrospective and say, we didn't know all these things at the front door, but now we did our best. And now we can verify that we did a lot of things right. And we missed a few things, but we can go back and
Hmm.
tend to those. So I think it's all, it's not like I said, it's not like the ship has sailed. It's just like we're just getting on board, you know?
Yeah, absolutely. And it's a good way to adapt too. I think that the grand challenges, I think they will be gladly surprised to see how many things they've already
Yeah.
actually thought through, because they also have very capable team members who have been thinking about these things. And then there will be really good added values that come from your checklist, because these are things that not everybody thinks about every day. So I think it'll
Yeah.
be, I think
And I
it'll
think
be
my
gratifying.
excitement about this is that it shows that ethical reflection happens in so many different ways.
Mm.
And I think about my conversations with Tim from way back when Tim would say, "Well, we were exempt. We don't have to think about that anymore." And I would like, "No, no, no."
Well, and maybe connected to that, and I guess this whole discussion, right, is harder and also with other people because there's really just a backlog accrual of addressing data issues, right? So, you can jump to AI ready, but I guess even before that, there are all these things we would love to have in the last decades, right, that were not required. No one really considered. There's maybe disconnect between data generators and people using data, right? All these things that we now are coming to bear in the convergence, I guess. And that I think in some ways is a lot, right? And so I
It
don't know
is.
if there's some way to parse this even in smaller bits, right? And
Yeah,
it
that's why I
also,
was thinking about just
yeah,
doing 3 sections, like
mm,
one section a month, something that's doable.
right, right.
Yeah, I think
Right,
that's really important.
because I think already we've seen some cases where you say this is all required for data AI readiness, but then people say, well, it's really for all data. And then in some ways they sound confused, right? That's why do I need to focus on this specifically? Whereas it's all important for data in general, I guess, right? And also feeds into AI readiness. So I think that's been maybe one challenge, right? And then also that things are moving quickly out there. Right?
Yeah, context matters and socialization is incredibly important. Well, thank you all so much for your comments, your questions, your thoughts. I really appreciate it. And Brittany is putting in a note about the next talk. Brittany, do you want to tell us say it out loud, or do you want me to?
Sure. Everyone should have received the flyer who has the Bridge to AI admin listserv as one of their listserv connections. But that's going to be happening on Tuesday, February 17th, next month, same time, same Zoom link. And Dr. Susanna Rose will be leading us in a discussion. And I dropped in the title there. And feel free to email us if you don't have it on your calendar already.
Thank you, Brittany.
Great job, Camille.
Yes,
Gives us something to
fantastic.
aspire to.
Well, thank you. Thanks again, everybody, for being here and for your questions and comments. I look forward to next steps on this because I really want to see something stick here.
Thanks for the invite. That was great. Appreciate it.
Yeah. Take care,
Cheers.
everyone. Bye.